Question 1. Animal nutrition, life stage specific diets. A pet owner brings in their 2-year-old golden retriever who has been experiencing digestive upset after eating regular adult dog food. The veterinarian diagnoses the dog with food sensitivity, recommending a more easily digestible diet for its breed and age. Which of the following is the best recommendation to address this issue? A. Feed the dog a high-protein, low-carb adult dog food. B. Feed the dog a puppy formula food to increase caloric intake. C. Feed the dog a senior-specific diet for improved digestion. D. Feed the dog a grain-free, easily digestible adult food. Answer: D. Feed the dog a grain-free, easily digestible adult food. Explanation: For a 2-year-old golden retriever with digestive issues, feeding the grain-free, easily digestible adult food would be ideal. Adult dog food designed for sensitive stomachs typically includes more easily digestible ingredients and is lower in fat, which can help avoid gastrointestinal upset. The grain-free option is often recommended for dogs with food sensitivities or allergies. Why not A? High protein and low carb diets are often more suited for working dogs or those requiring more energy. While some may tolerate such diets, they can exacerbate digestive issues in sensitive dogs. Why not B? Puppy food is formulated for growth and development and contains higher calories and fat. This would not be appropriate for a mature dog with digestive issues. Why not C? Senior dog foods are tailored to older dogs and may be too low in calories or have ingredients not suitable for a young adult dog. They typically contain fewer proteins and higher fiber to manage age-related conditions, not digestive upset. Question 2. Emergency and critical care. Triage and initial patient assessment. While volunteering at a veterinary clinic, you are tasked with triaging an emergency case. A 5-year-old Labrador retriever arrives with a history of vomiting, lethargy, and a bloated abdomen. The owner reports the symptoms began a few hours ago. Upon initial assessment, the dog appears distressed with a rapid heart rate, elevated respiratory rate, and a distended abdomen. What should be your first priority in managing this case? A. Administer pain medications and fluids immediately. B. Perform a detailed history and diagnostic tests before initiating treatment. C. Stabilize the dog by administering intravenous fluids and preparing for gastric decompression. D. Wait for the veterinarian to arrive before taking any action. Answer: C. Stabilize the dog by administering intravenous fluids and preparing for gastric decompression. Explanation: This case presents a gastric dilatation volvular GDV, commonly known as bloat, a life-threatening condition where the stomach fills with gas and twists on itself. Immediate action is necessary. GDV can progress rapidly to shock and death. The priority is to stabilize the patient by administering intravenous fluid, correct dehydration and shock while preparing for surgical or non-surgical gastric decompression. Why not A? Pain medications are crucial for comfort but must be administered cautiously in cases of DDV due to the potential for mask symptoms or interactions with anesthesia during surgery. Why not B? Performing diagnostic tests and gathering detailed history can delay life-saving interventions in an emergency. Immediate stabilization takes precedence. Why not D? Waiting for the veterinarian in an emergency situation can result in irreversible damage or death, especially in cases like DDV where time is critical. Question 3. Veterinary pharmacology, antibiotics, analgesics, and anesthetics. A veterinarian prescribes a broad-spectrum antibiotic for a 6-month-old kitten diagnosed with an upper respiratory infection, URI. The kitten has no known allergies and is in otherwise good health. However, the owner is concerned about the potential side effects and asks for a detailed explanation of why the antibiotic was prescribed. What is the most explanation for the veterinarian's decision to prescribe this antibiotic? A. The antibiotic is used to treat bacterial infections, and URIs are typically viral in nature, so the antibiotic will be ineffective. B. The antibiotic targets specific bacterial pathogens commonly found in upper respiratory infections in young kittens. C. The antibiotic is a preventive measure to avoid secondary bacterial infections in kittens with compromised immune systems. D. The antibiotic is used for its anti-inflammatory rather than its antibacterial effects. Answer: B. The antibiotic targets specific bacterial pathogens commonly found in upper respiratory infections in young kittens. Explanation: Upper respiratory infections, urus in kittens, are often caused by bacterial pathogens such as Bordetella bronchi septica or Chlamydia feles, which can exacerbate symptoms and lead to secondary bacterial infections. A broad-spectrum antibiotic is appropriate to treat these specific bacterial infections. Urus can result from both viral and bacterial agents. While viral urus don't require antibiotics, bacterial infections complicating the viral infection do. Why not? Although some urus are viral, secondary bacterial infections are common in young kittens, so antibiotics are prescribed to address the bacterial component. Why not? Antibiotics are not typically used as preventive measure unless there's specific risk of bacterial complications, which isn't established in the case of an otherwise healthy kitten. Why not? Antibiotics are not prescribed for their anti-inflammatory properties. They are prescribed to treat bacterial infections, not inflammation. Question 4. Animal anatomy and physiology. Musculoskeletal system. A veterinarian is examining a 4-year-old border collie with a history of lameness in the right rear leg. Upon physical examination, the veterinarian notices the dog is reluctant to bear weight on the leg and displays pain when palpating the hip area. X-rays show signs of hip dysplasia with joint subluxation. Which of the following structures is most likely affected in this case? A. The femoral head and acetabulum of the hip joint. B. The patella and femur in the knee joint. C. The tibia and fibula in the lower leg. D. The carpal bones in the wrist joint. Answer A. The femoral head and acetabulum of the hip joint. Explanation. Hip dysplasia is a common musculoskeletal disorder in dogs, especially in large breeds like border collies. The condition involves malformation of the femoral head and the acetabulum, the socket in the pelvis, which can lead to joint subluxation, partial dislocation, and arthritis. This condition typically affects the hip joint, causing pain and lameness as seen in this case. Not B. The patella, kneecap, and femur are part of the knee joint, not the hip. Hip dysplasia involves the hip joint specifically, not the knee. Why not? C. The tibia and fibula are in the lower leg and do not typically relate to hip dysplasia. The condition affects the ball and socket joint of the hip. Why not? D. The carpal bones are part of the wrist joint, and their involvement is unlikely in this case as the dog is showing signs of pain in the hip area. Question 5. Veterinary ethics and legal responsibilities. Informed consent during a routine checkup. A 7-year-old cat is diagnosed with a benign tumor on the right rear leg. The veterinarian recommends surgical removal of the tumor but does not provide the owner with details about the potential risks, complications, or alternative treatments. The owner is unaware of the full scope of the procedure before giving consent. Which of the following statements most accurately reflects the ethical violation in this situation? A. The veterinarian failed to obtain verbal consent from the owner. B. The veterinarian violated the principle of informed consent by not fully disclosing the risks and alternatives. C. The veterinarian should have refused to perform surgery due to the age of the cat. D. The veterinarian should have asked for written consent before proceeding with the procedure. Answer. B. The veterinarian violated the principle of informed consent by not fully disclosing the risks and alternatives. Explanation. The principle of informed consent requires that the veterinarian fully explain the procedure, risks, benefits, and alternatives to the pet owner before they consent to treatment. In this case, the veterinarian did not provide sufficient information, thereby violating ethical guidelines regarding client communication. Informed decision-making. Why not? A. While verbal consent is important, informed consent focuses on providing adequate information. Written consent is not the primary issue here. Why not? C. The veterinarian's decision to recommend surgery is not inherently unethical. The focus should be on the process of obtaining informed consent. Why not? D. While written consent can be beneficial, it is not required for all procedures, and the main ethical concern here is the failure to inform the owner properly. Question 6. Laboratory procedures. Blood sample collection. A veterinary technician is collecting a blood sample from a dog for a complete blood count (CBC) and serum chemistry panel. The technician notices the dog is agitated and attempts to draw blood from the cephalic vein. The blood collection is unsuccessful and the technician is considering other sites. Which of the following is the next best option for blood collection after failing in the cephalic vein? A. Jugular vein. B. Femoral vein. C. Saphenous vein. D. Subcutaneous space. Answer A. Jugular vein. Explanation. If blood collection from the cephalic vein fails, the jugular vein is the next best option for most dogs. The jugular vein is a large vein that provides easy access to blood and can be used in difficult cases or when other veins are inaccessible. Why not be? The femoral vein is often used in cats or small dogs, but it is generally more difficult to access in larger dogs. Additionally, the femoral vein may not be as large as the jugular for adequate blood collection. Why not C? The saphenous vein is an option for blood collection, especially in smaller dogs or when other veins are not available, but it is more commonly used for intravenous catheter placement. Why not D? Subcutaneous space is not a site for blood collection. It is typically used for fluid administration or for certain types of injections. Question 7. Animal behavior and welfare stress reduction. A veterinary technician notices that a dog becomes highly stressed when brought into the examination room. The dog exhibits panting, drooling, and attempts to escape the area. The technician recognizes that these behaviors are common signs of stress and anxiety in veterinary settings. Which of the following strategies would be most effective in reducing the dog's stress during the examination? A. Bring the dog directly into the examination room and proceed with the exam. B. Allow the dog to interact with the staff and other animals in the waiting area. C. Use pheromone diffuser or calming treats to create a soothing environment. D. Restrain the dog immediately and begin the examination quicker. Answer C. Use a pheromone diffuser or calming treats to create a soothing environment. Explanation. Using a pheromone diffuser or calming treats is a proven method to reduce anxiety in dogs by mimicking natural calming pheromones. These strategies can help create a more comfortable and less stressful environment for the dog during the examination. Why not? Bringing the dog directly into the examination room without addressing its stress could worsen its anxiety, potentially leading to aggressive behavior or difficulty in handling. Why not B? Allowing the dog to interact with other animals may increase stress, as dogs in veterinary clinics are often sensitive to the presence of unfamiliar animals. Why not D? Immediate restraint and a rushed examination can increase stress and cause negative associations with the veterinary visit, making future visits more difficult. Question 8. Veterinary ethics and legal responsibilities. Informed consent. A 7-year-old dog, Bella, is presented to the veterinary clinic for evaluation of a lump found on her abdomen. The veterinarian recommends biopsy to determine whether the lump is malignant, but the owner is concerned about the cost and potential complications. The veterinarian explains the procedure and its risks in detail, but does not provide any information about alternative diagnostic options. The owner agrees to the biopsy. Which of the following ethical and legal principles is most relevant to this situation? A. Informed consent. B. Veterinary client-patient relationship (EPR). C. Patient confidentiality. D. Duty to care. Answer A. Informed consent. Explanation. Informed consent is the process by which a veterinary professional explains the nature of a proposed treatment or procedure, including its risks, benefits, and alternatives to the client. The client must fully understand the information before agreeing to proceed with the treatment. In this case, the veterinarian explained the biopsy procedure and its risks, but failed to offer alternative diagnostic options. Therefore, while the consent may have been given, it might not have been fully informed if the alternatives were not discussed. Why not be? The veterinary client-patient relationship (ER) refers to the professional relationship between the veterinarian, client, and patient, but it does not specifically address the need for thorough explanation of procedures and alternatives, which is a key part of informed consent. Why not C? Patient confidentiality pertains to protecting the private health information of the animal and its owner, but this is not the primary concern in this situation. Why not D? The duty to care refers to the veterinarian's obligation to provide appropriate medical care and act in the best interest of the patient, but it does not encompass the process of obtaining informed consent for procedures. Question 9. Animal nursing and clinical care, pain management. A veterinarian diagnoses a 5-year-old boxer with a moderate fracture in its hind leg. The veterinarian prescribes a combination of pain management medications, including an opioid analgesic and a non-steroidal anti-inflammatory drug, NSAID. Which of the following is the primary concern when using both opioid analgesics and NSAIDs for pain management in this patient? A. Increased risk of gastrointestinal ulcers and bleeding. B. Delayed healing of the fracture due to medication interference. C. Increased risk of opioid overdose and sedation. D. Risk of chronic kidney damage from prolonged NSAID use. Answer A. Increased risk of gastrointestinal ulcers and bleeding. Explanation. The combination of opioid analgesics and NSAIDs increases the risk of gastrointestinal ulcers and bleeding, as both drug classes can irritate the stomach lining. While NSAIDs are effective for inflammation and pain relief, they can cause stomach ulcers, especially when combined with opioids, which may also have gastrointestinal side effects. Why not B? While pain medications may affect overall healing, this is not the primary concern with the combination of opioids and NSAIDs. The most pressing issue is gastrointestinal risk. Why not C? Although opioid overdose and sedation are possible, they are more associated with the overuse of opioids alone, not with the combination of opioids and NSAIDs at the prescribed dosage. Why not D? Chronic kidney damage is a concern with prolonged NSAID use, but it is not as immediate a risk when used short-term for acute pain management in this case. Question 10. Exotics and wildlife care, nutrition and environmental requirements. A veterinary technician is caring for a young ball python brought in with signs of lethargy and poor appetite. Upon examination, the technician determines the snake's environment is suboptimal with incorrect humidity and temperature levels. What is the most important environmental factor to address first in order to improve the snake's health? A. Decrease the ambient temperature to prevent overheating. B. Increase the humidity level to mimic the snake's natural habitat. C. Provide the snake with larger enclosure for better mobility. D. Provide constant light source to regulate the snake's circadian rhythm. Answer. B. Increase the humidity level to mimic the snake's natural habitat. Explanation. Ball pythons are native to regions with high humidity. Low humidity can lead to dehydration, poor shedding, and overall lethargy. Therefore, the first priority is to correct the humidity level in the snake's environment. Why not A? While temperature control is important, increasing humidity is the most immediate issue for this snake. Why not C? While proper enclosure size is important, it does not directly address the immediate health issue of improper humidity. Why not D? Constant light exposure is not a critical factor in this scenario. Temperature and humidity control are more urgent to the snake's well-being. Question 11. Veterinary diagnostics urinalysis. A veterinary technician is performing a urinalysis on a 6-year-old Labrador retriever with a suspected urinary tract infection (UT). The technician observes that the urine sample has a specific gravity of 1.10, a slightly cloudy appearance, and an elevated number of white blood cells under microscopic examination. Which of the following findings is most likely associated with UE8 presence of protein and glucose in the urine? B. Decreased specific gravity in the presence of bacteria. C. Presence of crystals and increased red blood cells. D. Decreased specific gravity in the absence of bacteria. Answer. B. Decreased specific gravity in the presence of bacteria. Explanation. A urinary tract infection (UT) often leads to an elevated number of white blood cells and bacteria in the urine. In this case, the specific gravity of 1.10 suggests that the urine is more diluted, which is common in infections or kidney-related issues. The presence of bacteria is a hallmark of a UE. Why not A? Protein and glucose in the urine may indicate other conditions, such as diabetes or kidney disease, but are not specific to a UE. Why not C? Crystals and red blood cells are often associated with bladder stones or trauma, not a typical UT. Why not D? A UT is typically accompanied by bacteria, not the absence of it. Question 12. Animal surgery, post-operative care. A 3-year-old Dachshund has undergone a routine space surgery, and the veterinary technician is responsible for post-operative care. The technician notices that the dog is shivering and appears restless 2 hours post-surgery. The dog's vital signs are stable. Which of the following is the most likely cause of the dog's symptoms, and what should be done next? A. Hypothermia due to anesthesia. The dog should be warmed slowly using blankets or heating pads. B. Anxiety related to the surgery. The dog should be given an anxiolytic medication. C. Pain from the surgery. The dog should be administered additional pain medications. D. Infection at the surgical site. The dog should be isolated from other animals. Answer A. Hypothermia due to anesthesia, and the dog should be warmed slowly using blankets or heating pads. Explanation. After surgery, hypothermia is common due to the effects of anesthesia, which can cause a drop in body temperature. Shivering and restlessness are typical signs of the body trying to warm itself. The dog should be warmed slowly using blankets or heating pads to avoid thermal shock. Why not B? Anxiety could cause restlessness, but shivering post-surgery is more often due to temperature regulation issues. Why not C? While pain management is important, the symptoms described are more consistent with hypothermia, not pain. Why not D? Infection is A concern, but the symptoms are more likely to be related to temperature rather than a surgical complication at this stage. Question 13. Veterinary pharmacology, antibiotics. A veterinarian prescribes amoxicillin to a 4-month-old kitten with a bacterial respiratory infection. The kitten weighs 1.5 kilograms and the prescribed dosage is 20 mg per kilogram of body weight to be administered every 8 hours. How many milligrams of amoxicillin should be given to the kitten per dose? A. 20 mg, B. 30 mg, C. 40 mg, D. 60 mg. Answer C. 40 mg. Explanation. The dosage is calculated as follows: 1.5 kilograms x 20 equals 30 mg. So the kitten should receive 30 mg per dose. Why not A? 20 mg is too low for the kitten's weight. Why not B? 30 mg is correct for the first calculation, but the answer should be 40 mg for an accurate per dose amount. Why not D? 60 mg would be an overestimation based on the weight and prescribed dose. Question 14. Animal behavior, separation anxiety. A 2-year-old golden retriever is brought to the clinic with symptoms of separation anxiety, including excessive barking, drooling, and destruction of furniture when left alone. Which of the following would be the most appropriate initial intervention for this condition? A. Increase the dog's exercise and provide puzzle toys to keep it occupied. B. Administer anti-anxiety medication immediately to calm the dog. C. Ignore the dog's distress when it is left alone to prevent reinforcing the behavior. D. Confine the dog in crate for extended periods of time when left alone. Answer A. Increase the dog's exercise and provide puzzle toys to keep it occupied. Explanation. For dogs with separation anxiety, increasing exercise and mental stimulation through puzzle toys can help reduce anxiety by tiring the dog out and providing distractions when alone. This helps them feel more secure and less likely to exhibit destructive behavior. Why not B? Anti-anxiety medication may be helpful in some cases, but addressing behavioral causes through environmental changes is typically the first step. Why not C? Ignoring the dog's distress may worsen the anxiety, as it does not address the root cause of the behavior. Why not D? Confining the dog in crate for long periods can exacerbate anxiety, as it may cause the dog to feel trapped and more anxious. Question 15. Exotic animal care, reptile husbandry. A veterinary technician is working with a bearded dragon that appears lethargic and is not eating. The technician reviews the animal's enclosure and notes that the temperature gradient is inadequate, with the hot side of the tank only reaching 75 degrees. What is the most appropriate action to improve the health of the bearded dragon? A. Increase the temperature on the hot side of the tank to 95 degrees and provide UV lighting. B. Decrease the temperature on the cool side of the tank to 65 degrees. C. Provide the bearded dragon with higher humidity level to aid in digestion. D. Offer the bearded dragon a variety of foods to stimulate appetite. Answer A. Increase the temperature on the hot side of the tank to 95 degrees and provide UV lighting. Explanation. Bearded dragons are ectothermic and require proper temperature gradient to regulate their body temperature. The hot side of the tank should reach 95 degrees to allow the bearded dragon to properly digest food and remain active. UV lighting is also necessary for their overall health, as it helps them synthesize vitamin D and absorb calcium. Why not B? Cooler temperature on the cool side is important, but it is the lack of proper warmth on the hot side that needs correction. Why not C? Bearded dragons do not require high humidity, and excessive humidity can actually be harmful. Why not D? While diet is important, the primary concern here is correcting the temperature gradient and providing proper lighting. Question 16. Animal anatomy and physiology. Musculoskeletal system. A 6-year-old German Shepherd has been diagnosed with hip dysplasia. During the examination, the veterinary technician observes difficulty in standing after resting and reluctance to climb stairs. What is the underlying anatomical issue in hip dysplasia that causes these symptoms? A. Abnormalities in the shoulder joint leading to difficulty in movement. B. Inadequate development of the femoral head within the acetabulum. C. Inflammation in the vertebral discs causing pain in the back. D. Weakness in the hind limb muscles leading to instability. Answer B. Inadequate development of the femoral head within the acetabulum. Explanation. Hip dysplasia is a condition where the femoral head ball does not fit properly into the acetabulum socket of the pelvis. This leads to instability in the hip joint, causing pain and discomfort during movement, particularly after periods of rest. Over time, this can result in degenerative changes like arthritis. Why not A? Shoulder joint abnormalities would cause front limb issues, not the symptoms of hip dysplasia. Why not C? Inflammation of the vertebral discs would cause back pain, but it is not directly related to hip dysplasia. Why not D? While weakness in muscles may be secondary to dysplasia, the primary issue is the improper development of the femoral head and acetabulum. Question 17. Veterinary pharmacology antibiotics. A 5-year-old domestic short-eye cat is being treated for a respiratory infection with doxycycline. The veterinarian mentions to the technician that the cat has a history of kidney disease. What is the most important consideration regarding the use of doxycycline in this case? A. Doxycycline is contraindicated due to its potential to cause kidney toxicity. B. Doxycycline dosage should be reduced due to renal impairment. C. Doxycycline may cause gastrointestinal upset, so it should be administered with food. D. Doxycycline is safe in renal disease without any adjustment needed. Answer: B. Doxycycline dosage should be reduced due to renal impairment. Explanation: doxycycline is eliminated primarily through the kidneys. In animals with kidney disease, there may be a reduced ability to clear the drug, which can lead to toxicity. The dosage of doxycycline should be reduced, or the drug should be avoided entirely depending on the severity of the kidney disease. Why not A? Doxycycline is not generally contraindicated for kidney disease, but caution is necessary and dosing adjustments are required. Why not C? While doxycycline may cause gastrointestinal upset, the primary concern in this case is the renal impairment, not gastrointestinal issues. Why not D? No medication should be used without considering renal function in animals with kidney disease, and dosage adjustments are often needed. Question 18. Veterinary ethics and legal responsibilities. Informed consent. A client brings in their 2-year-old dog for a routine procedure to remove a benign growth. During the procedure, the veterinary technician notices a potential malignant tumor. The veterinarian suggests that additional diagnostic tests are necessary to rule out cancer. What should the veterinary technician do next in this scenario? A. Inform the client that the tumor is likely benign and proceed with the planned surgery. B. Proceed with the surgery as planned, but without informing the client immediately. C. Obtain informed consent from the client for additional testing and procedures. D. Avoid discussing the issue with the client and leave the decision to the veterinarian. Answer: C. Obtain informed consent from the client for additional testing and procedures. Explanation: the veterinary technician must ensure that the client is fully informed about the situation and consents to any additional tests or procedures before they are carried out. Informed consent is crucial in veterinary ethics and legal responsibilities, as it ensures that the client understands the potential risks, benefits, and costs associated with the treatment. Why not A? The technician should not assume that the tumor is benign without further diagnostic work and should seek the client's consent for further evaluation. Why not B? Proceeding without informing the client would violate ethical standards and legal requirements for informed consent. Why not D? The technician has an obligation to inform the client and help facilitate the decision-making process, not to avoid the issue. Question 19. Emergency and critical care. Trauma. A 4-year-old border collie is brought into the emergency clinic following a car accident. The dog is conscious but exhibits shallow breathing, pale mucous membranes, and a rapid heart rate. Which of the following is the most likely immediate cause of these symptoms, and what should the technician do next? A. Hemorrhagic shock due to internal bleeding. Initiate intravenous fluid therapy immediately. B. Pneumothorax from rib fractures. Apply an oxygen mask and monitor closely. C. Hypovolemic shock from dehydration. Begin oral rehydration therapy. D. Sepsis from an infection. Administer antibiotics immediately. Answer A. Hemorrhagic shock due to internal bleeding. Initiate intravenous fluid therapy immediately. Explanation: hemorrhagic shock is a common result of trauma, especially following a car accident where internal bleeding can lead to hypovolemia, low blood volume. Symptoms like pale mucous membranes, rapid heart rate, and shallow breathing are indicative of shock. Intravenous fluid therapy is essential to restore blood volume and maintain circulation while addressing the underlying cause of the bleeding. Why not B? Pneumothorax can cause respiratory distress, but the symptoms described are more consistent with shock due to blood loss. Why not C? Dehydration could be an issue but would not explain the pale mucous membranes or rapid heart rate as much as hemorrhagic shock. Why not D? Sepsis typically develops after an infection has progressed, not immediately following trauma. Question 20. Surgical assisting aseptic technique. A veterinary technician is preparing a sterile surgical field for a routine space surgery. During the setup, The technician accidentally touches the sterile drape with their non-sterile gloves. What should the technician do immediately to ensure that the surgical field remains sterile? A. Clean the contaminated area with an antiseptic solution. B. Discard the sterile drape and replace it with a new one. C. Continue with the procedure as the contamination is minor. D. Cover the contaminated area with a sterile cloth and proceed. Answer: B. Discard the sterile drape and replace it with a new one. Explanation: sterility is paramount in any surgical setting. Once a sterile item is contaminated, it cannot be reused, as even a small breach can introduce bacteria and increase the risk of infection. In this case, the contaminated sterile drape must be discarded and replaced to maintain a sterile field. Why not A? Simply cleaning the contaminated area does not restore sterility. Why not C? Continuing with the procedure with contamination would be unsafe and unethical. Why not D? Covering the contaminated area does not address the core issue, which is maintaining sterility throughout the surgical environment. Question 21. Animal nutrition, dietary requirements. A 10-year-old Labrador Retriever has been diagnosed with chronic kidney disease, CKD. The veterinarian advises that the dog be placed on a special renal diet to manage the condition. Which of the following components is most important to reduce in the dog's diet to help manage kidney disease? A. Protein. B. Carbohydrates. C. Fats. D. Fiber. Answer: A. Protein. Explanation: in chronic kidney disease, excessive protein can exacerbate kidney damage by increasing waste products that the kidneys must filter. A low-protein diet is recommended to reduce the kidney's workload and slow the progression of the disease. Why not B? Carbohydrates are not typically restricted in renal diets. They provide energy without stressing the kidneys. Why not C? Fats are generally not restricted, but should be used in moderation as they provide energy. Why not D? Fiber is generally included in renal diets to aid in digestion, but it is not the primary concern in managing kidney disease. Question 22. Veterinary anesthesia monitoring during a surgical procedure. The veterinary technician notices that a dog under general anesthesia is showing a decreased heart rate and respiratory rate. The technician checks the patient's vital signs and notices that the blood pressure is also low. What is the most appropriate action to take? A. Administer an anticholinergic drug to increase heart rate. B. Decrease the anesthetic depth to improve blood pressure. C. Increase the anesthetic depth to induce more sedation. D. Stop the procedure immediately and consult the veterinarian. Answer: B. Decrease the anesthetic depth to improve blood pressure. Explanation: when an animal under anesthesia exhibits low heart rate, respiratory rate, and blood pressure, it often indicates that the anesthetic depth is too deep. Reducing the anesthetic depth can help stabilize the patient's vital signs by allowing the body to maintain a more normal cardiovascular response. Why not A? Anticholinergic drugs are used to increase heart rate, but in this case, the primary concern is the anesthetic depth, not just the heart rate. Why not C? Increasing anesthetic depth would likely worsen the problem, further decreasing blood pressure. Why not D? Stopping the procedure is unnecessary if adjusting the anesthetic depth can resolve the issue. Immediate consultation may not be required unless symptoms persist. Question 23. Veterinary diagnostic testing, laboratory procedures. A veterinarian orders a complete blood count, CBC, and serum chemistry panel for a sick dog. When reviewing the CBC results, the veterinary technician notes that the dog has a low hematocrit (HET). What does a low hematocrit indicate about the patient's health status? A. The dog is dehydrated. B. The dog may have anemia. C. The dog is suffering from liver disease. D. The dog has an infection. Answer: B. The dog may have anemia. Explanation: a low hematocrit (HET), which represents the percentage of blood volume made up of red blood cells, indicates that the animal may be suffering from anemia. Anemia is often caused by blood loss, insufficient production of red blood cells, or increased destruction of red blood cells. Why not A? Dehydration would usually cause an increased hematocrit due to reduced plasma volume, not a decreased one. Why not C? Liver disease can affect blood clotting, but it does not typically cause a low hematocrit. Why not D? An infection may cause changes in white blood cell counts but does not directly result in a low hematocrit. Question 24. Veterinary surgery, post-operative care. A dog has undergone spaying surgery and the veterinary technician is preparing to discharge the animal. The technician observes that the dog is not fully alert, still lying down, and has slow reflexes. What is the best course of action? A. Allow the dog to rest for a while longer and monitor vital signs. B. Administer an intravenous fluid bolus to revive the dog. C. Discharge the dog immediately since the procedure was routine. D. Stimulate the dog to stand up and walk around to prevent complications. Answer A. Allow the dog to rest for a while longer and monitor vital signs. Explanation. After anesthesia, it is important to allow animals to fully recover and regain full alertness before being discharged. The dog may still be under the effects of anesthesia, so it is important to monitor vital signs and ensure the animal is stable before discharge. Why not B? Ministering fluids may not be necessary unless the animal is dehydrated or in shock. Why not C? Discharging the dog before it has fully recovered from anesthesia could be dangerous. Why not D? Stimulating the dog to stand could cause stress and injury while the dog is still under the effects of anesthesia. Question 25. Animal behavior common disorders. A 7-year-old Dachshund has recently started excessively licking its paws and chewing on its tail. The behavior occurs primarily when the dog is left alone, and it seems to be a response to stress. What is the most likely cause of this behavior? A. The dog has developed a skin infection. B. The dog is experiencing separation anxiety. C. The dog has an underlying neurodegenerative condition. D. The dog is exhibiting signs of allergic reactions. Answer. B. The dog is experiencing separation anxiety. Explanation. Separation anxiety is a common behavioral issue in dogs where they exhibit stress-related behaviors when left alone, such as licking paws or chewing their tail. These actions are often self-soothing behaviors in response to anxiety or stress. Why not A? While skin infections can cause licking, the behavior described is likely related to anxiety rather than a physical condition. Why not C? Neurodegenerative conditions typically cause more severe, progressive neurological signs, not anxiety-based behaviors. Why not D? Allergic reactions can cause itching and licking, but the pattern of behavior in response to being left alone points to anxiety. Question 26. Animal anatomy and physiology. Musculoskeletal system. A 3-year-old mixed breed dog presents with limping and difficulty bearing weight on its left hind leg. The veterinarian suspects a cranial cruciate ligament (CCL) injury. Which of the following is the primary function of the cranial cruciate ligament in a dog's knee? A. Prevents hyperextension of the knee joint. B. Prevents medial rotation of the tibia. C. Stabilizes the hip joint during running. D. Prevents flexion of the stifle joint. Answer. B. Prevents medial rotation of the tibia. Explanation. The cranial cruciate ligament (CCL) primarily functions to stabilize the stifle joint, knee joint, by preventing the medial rotation of the tibia relative to the femur. Injury to the CCL can cause instability and lead to pain, lameness, and functional impairment of the limb. Why not A? The CCL does not directly prevent hyperextension of the knee joint. That function is more related to the other ligaments in the joint. Why not C? The CCL stabilizes the stifle joint, not the hip joint. Why not D? Flexion of the stifle joint is not directly controlled by the CCL. Question 27. Veterinary pharmacology drug classifications. A veterinarian prescribes a corticosteroid for a dog diagnosed with an allergic skin condition. Which of the following is the most common side effect associated with the long-term use of corticosteroids in dogs? A. Increased appetite and weight gain. B. Decreased heart rate and low blood pressure. C. Increased blood sugar and potential for diabetes. D. Hypothermia and shivering. Answer. A. Increased appetite and weight gain. Explanation. Corticosteroids are anti-inflammatory drugs commonly used to treat allergic conditions, but their long-term use can lead to several side effects. Increased appetite and weight gain are among the most common adverse effects. Corticosteroids stimulate appetite and cause fluid retention, which can contribute to weight gain. Why not B? Corticosteroids can cause increased blood pressure, not decreased heart rate or low blood pressure. Why not C? Although corticosteroids can increase blood glucose levels, leading to a risk of diabetes, increased appetite and weight gain are more commonly observed. Why not D? Hypothermia and shivering are not typically associated with corticosteroid use. Question 28. Veterinary surgery instruments and techniques. A surgical team is preparing to perform a spay procedure on a dog. The veterinary technician is responsible for selecting the appropriate instrument for incising the abdominal wall. Which of the following surgical instruments is most commonly used for this purpose? A. Scalpel. B. Hemostat. C. Needle holder. D. Surgical scissors. Answer. A. Scalpel. Explanation. A scalpel is the primary instrument used for making precise incisions in the skin or abdominal wall during surgery. It allows for clean, controlled cuts and minimizes tissue trauma. The blade is typically disposable to ensure sterility. Why not B? A hemostat is used to clamp blood vessels and control bleeding, not for making incisions. Why not C? A needle holder is used for suturing, not for making incisions. Why not D? Surgical scissors are used to cut tissues or sutures, but they're not typically used for making initial incisions in soft tissue. Question 29. Emergency and critical care triage. A veterinarian is assessing a dog involved in a hit-and-run accident. The dog is unconscious, has labored breathing, and shows signs of severe shock. What is the first priority in the emergency care of this patient? A. Administer intravenous fluids immediately. B. Begin cardiopulmonary resuscitation, CPR. C. Control external bleeding. D. Stabilize the airway and ensure adequate breathing. Answer D. Stabilize the airway and ensure adequate breathing. Explanation. In emergency medicine, the first priority is to ensure that the patient has a clear airway and is able to breathe adequately. Without proper oxygenation, other interventions, e.g. CPR, fluids, or bleeding control, will not be effective. Ensuring adequate ventilation is critical to stabilizing the patient before moving on to other life-saving measures. Why not A? Intravenous fluids may be necessary after stabilizing the airway and breathing, but airway management takes precedence. Why not B? CPR is performed if there is no heartbeat or if the patient is not breathing, but the initial focus should be on airway management. Why not C? While controlling bleeding is important, establishing adequate oxygenation through airway management takes precedence over bleeding control in this scenario. Question 30. Animal behavior and welfare. Stress reduction. A cat becomes agitated and fearful during veterinary visits. It often hides in its carrier and hisses when approached. The veterinary team has decided to implement strategies to reduce the cat's stress during the examination. Which of the following strategies would be most effective in reducing stress in this cat? A. Administering sedative prior to the visit. B. Using pheromone diffuser in the exam room. C. Placing the cat in cage with other animals to reduce isolation. D. Handling the cat immediately upon entering the exam room. Answer B. Using a pheromone diffuser in the exam room. Explanation. Pheromone diffusers mimic natural calming scents that help reduce stress and anxiety in cats. These diffusers work by releasing synthetic feline facial pheromones, which promote relaxation and reduce the behavioral signs of fear and anxiety in a clinical setting. Why not A? While sedatives may be used in certain cases, they should not be the first line of action as they do not address the root cause of the anxiety. Why not C? Placing the cat with other animals might increase stress, as cats are often territorial and may not feel secure in the presence of unfamiliar animals. Why not D? Immediate handling can increase the cat's fear response. It's important to approach the cat calmly and allow it to adjust to the environment before handling.